Get hit in the face. Oh my goodness, that is a lot of swelling quickly. Massive hematomas, ankles take a wrong turn, and other boxing injuries gone terribly, terribly wrong. Today we are breaking down and reacting to all of the brutal medical scenes and intense injuries from some of boxing's greatest matchups. Let's dive right in.
First fight.
Oh!
What happened here? He got bit, I think.
Human bites, animal bites, different types of traumas. Our mouths are quite dirty, so you have to cover it with different types of broad spectrum antibiotics.
Where did we get that on tape? Biting Holyfield in the right ear. Hurts like hell, but and that's a danger.
I remember hearing about this a long time ago. The outer aspect of the ear here was bitten off. Yes, you can try to put it back together, but there's a lot of cartilage. Cartilage does not have a lot of blood supply. It could take a very long time for it to heal. Then you also have a high risk of infection that won't be treated well because, again, you don't have a good amount of blood supply.
Left hooks, and that wasn't a dynamite left hook, but it was one of the few left hooks he's been able to get in.
Another left hook and a right hand by Garcia. And now, Garcia forced to take a knee.
So it's hitting the liver, the right upper quadrant of your abdomen or the lower part of your chest. By your ribs, the liver sits underneath that area.
Garcia's promoter, Oscar De La Hoya, who was stopped by Bernard Hopkins following a paralyzing body shot with a delayed reaction.
The capsule around the liver is very sensitive. The diaphragm sits right on top of the liver. So when you take a deep breath, the diaphragm pushes down on the organs of the abdomen and directly onto the liver.
Gervonta Tank Davis just stopped Ryan Garcia.
Things that I worry about as an ER doctor when you see injuries like this: hematoma, expanding blood within the liver itself, the liver being lacerated and bleeding out, and then also rib fractures causing pneumothorax and hemothorax, or even the rib puncturing into the liver causing issues.
You see it there, it just gives way. Oh, wow, that's nasty. That really is nasty.
Oh my gosh, you take a look at that right ankle of Robbie Davies. It's totally 90 degrees the other direction. And we see this a lot with fracture dislocations. Basically, you break the bone and then it dislocates out of joint. This happens more often in the emergency department than just a dislocation. Oh.
Now Lara may have hurt Angulo with that combination, and Angulo's hurt. And it's unbelievable.
Angolo's hurt. Let's see. Get hit in the face. Oh my goodness, that is a lot of swelling quickly. You think, okay, is there a fracture to the frontal bone, the zygomatic arch, or to the inferior orbits, or any of the bones around the orbits? If you feel like you need to sneeze, you ask patients to sneeze with their mouths open. That way they don't stifle it in case there is a fracture, especially in the inferior walls connected to the sinuses, and then air can get into the soft tissue.
Massive hematoma.
So even the announcers, massive hematoma. Is this just a massive ruptured blood vessel, thus causing significant amount of swelling hematoma there? Oh, look at this blood pouring out of that left ear. Oh man. I've seen, definitely injuries like this, usually due to like car accidents. It got ripped. Was there a defect there already? Was there already an injury, or was that significant amount of force that ripped that area?
Stop it right there.
Ouch. It didn't fully avulse off, which is good. What do you do when this happens? You want to take gauze, kind of squish the ear, and then pat it to the head itself. Put pressure so you decrease the bleeding. Then you need to get to a plastic surgeon. Oh, that's a lot of blood. Oh, right in the middle. Whoa, split open. We see this type of injury often enough when somebody falls. Super easy to fix, actually, but does bleed a lot because of the major blood vessels there. If you put enough pressure on the area, you'll get the bleeding to stop. But yeah, it's a big old gash right there in the forehead. We would do probably a couple subcutaneous sutures that are absorbable, and then non-absorbable stitches on the top. Oh, whoa. Are we allowed to tackle? Holy swollen face. Obviously, the first thing you think about swelling is just soft tissue trauma. You see people when they box that they're getting the metal thing pushed on their face. It's cold, and it's just causing pressure to the area to try to get the bleeding to stop underneath. Boom. Oh. Could this guy also have a broken bone of the nose because there's significant amount of swelling to the right side of the nose? Maybe. Obviously, boxers increase the risk of nasal fractures. The bone of the nose fracture is pretty easy when you're getting hit multiple times. That is a lot of swelling. There's a very small bone called the laminae papricia, which can fracture pretty darn easy and cause bleeding. There's some bleeding here, which means there's open lacerations. Hard to see exactly where those are coming from. They also could just be abrasions that the blood is seeping through because the glove itself ripped the tissue. As a professional athlete, you get all these injuries. It is crucial for your recovery. Even if I've had a really tough day at work, at the hospital, I always use Do Not Disturb to help me sleep and get that recovery that I need. Also, check out our other range of products at lifehappens.com.
Abraham back to make well heard him. Stunned Arthur Abraham, and there it is. Actually, it's the right uppercut.
Right uppercut to the left side jaw. Could have hit the angle of the ramus over here.
Pushed Arthur Abraham back, and I'm disoriented. We will see Edison Miranda. Now, there's very little doubt that was intentional. You see him take his head and just whack the side of his head.
Is the likelihood that this jaw fracture is related to the headbutt versus the initial uppercut? Hard to tell, but it looks like the headbutt hits more near the ear and the temporal bone versus up here at the temporomandibular joint.
And the doctor checking on Abraham's cut and also his jaw.
The doctor is looking actually inside of his mouth, and there's a laceration, there's an injury. So you can have an injury to the inside of the mouth because you got hit and your own teeth caught the mucosa on the inside. Very common.
It was an intentional headbutt.
You also see when somebody gets a fractured jaw that there is 2 points of the fracture. I've seen when people get hit on the side of the jaw, the fracture occurs where they get hit, but then there's another fracture that occurs further down the jaw.
Newman's focus is not on Abraham's jaw, but the intentional headbutt.
You'll probably get your jaw wired shut. You'll probably get what appears to be braces, have the mouth kind of wired shut, but still having some opening. The doctor will give you some pliers. That way, in case there's an emergency where you would say vomit, you need to cut these open so you don't aspirate and choke on your own vomit.
By Miranda, which the fight because of Miranda's intentional headbutt, Miranda should be disqualified.
You can get a fracture to the mandible, which is your jawbone, by getting headbutted by somebody else's skull, but it wouldn't have caused the bleeding within the mouth versus the direct blow due to the uppercut. These are pretty gnarly injuries. If you guys want me to continue to do reaction videos to injuries and talk about them, please let me know. I mean, there's a lot of sports out there that have a lot of different injuries. Definitely check out this playlist right here. Please binge watch everything. And as always, please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.